Good evening, everyone. I'm Caleb Buczynski, and tonight I'll be talking to you guys about lung cancer, specifically induced by smoking, since cancer and lung cancer on its own can be quite the broad topic to speak on. Some general information about lung cancer, it being one of the most prevalent forms of cancer just in the world. And in the U.S., there's about 1 million cases of it every year. Specifically caused by smoking. And then it is the leading cause, or smoking is the leading cause of lung cancer death as well. And just cancer death in general, causing about 160,000 deaths a year in the U.S. That was estimated in 2010. Hoping more up-to-date information comes out about that and seeing that number going down as more people are aware about it, but we'll get to that in later slides. About 90% of lung cancer is caused by smoking, 90% of the lung cancer cases in men are caused by smoking, and 70 to 80% of those lung cancer cases in women are caused by smoking. So the other percentages there are caused by things like asbestos and radon and that other carcinogens that you inhale, not necessarily through cigarettes or cigars or whatever, what have you. And I guess the general way that lung cancer works is that whenever you're smoking a cigarette, you inhaling that smoke irritates and therefore inflames your lungs. So that's already causing some of the cell damage, especially if you're going through a pack a day. You're damaging those cells just through that inflammation and irritation. And then on top of that, you have all the carcinogens and just like toxic stuff that is, like, you can see the pictures of even up here that it's just a graphic, but there's actual tar that builds up on your lungs, and that's toxic to your lung cells. Another thing that some of those carcinogens do is cause genetic and epigenetic effects. Biggest one being that they suppress the function of tumor suppressors, like, for your lungs. So whenever your lung cells are trying to repair and reproduce, that gets thrown off the tracks a good bit because those tumor suppressors, they don't work anymore. So whenever cell reproduction goes awry, your tumor suppressors aren't there to fix that. More information about lung cancer. You have two different categories, essentially. Small cell lung cancer, not really caused by smoking so much, so I won't be ranting about that. Up in the top right, you can see that pie chart does a good breakdown of smokers and non-smokers, just the distribution there. Non-small cell lung cancer, you have adenocarcinomas. Those are usually found on the peripheries of lungs, and they're also on bronchioles. And then you have squamous cell carcinomas, and those would be on the cells lining the bronchi, more likely to spread than adenocarcinomas. Granted, all lung cancer will spread. It's just further down the line here, it gets more and more aggressive than it already is. And that's the dangerous thing about lung cancer. It is invasive, rapidly grows, and it metastasizes early. So with large cell carcinomas next, it's a more rare form of lung cancer, but it can populate anywhere in the lungs. It doesn't normally have a specific area that it goes to. It populates anywhere in the lungs, and it will be very aggressive in its spread and its metastasizing. So some of the signs and symptoms of lung cancer, specifically for smokers, they're very insidious, and they're kind of insidious to begin with, because you could probably dismiss, a cough and a wheeze as just like, oh, I'm feeling under the weather or I have a cold, and you're going to kind of dismiss that. You're not going to think about seeing a doctor because of it. and then as some of these other symptoms go on, like feeling winded or fatigued after going for a walk or whatever, um, that'll just be brushed off as like, oh well, yeah, of course, I'm a smoker, like that happens to everybody, or um, feeling like lightheaded or something. That's from oh, the nicotine, it's a vasoconstrictor, so of course I'm going to be feeling lightheaded whenever I start doing something more active. Some of the other symptoms that are more noteworthy, and they're unfortunately systemic effects of cancer. So it's already going to be a little too late if you see these symptoms, like your total loss of appetite. And due to that, and then also just other systemic effect of cancer is severe and sudden weight loss, just general fatigue and malaise. I would say one of the biggest things that is still kind of an early warning sign would just be a chronic cough. Um, and your more clear and defining symptoms is that chronic cough, also coughing up just mucus and phlegm and that just other nasty stuff. But and it's always shown in the movies that the character has lung cancer is when he's coughing up blood. And that's from your lungs just deteriorating so much that you're starting to cough up chunks of lung. Not so much chunks, but just little itty bitty pieces, and this is coming out as blood. So those are unfortunately more clear and defining symptoms, and they come on at such a late stage that it's almost, I wouldn't say too late to help, because plenty of people still get treated, but lung cancer is rarely caught early enough to have a solid prognosis of say another 15 years. Usually the best prognosis on average is about 3 to 5 years. The way this is diagnosed, though, as you can see, there's chest x-rays. It'll look like a cloudy kind of just area in the x-ray. CT scans, you'll actually see the big mass there. You have biopsies, actually taking a chunk out of whatever lesion or tumor cell there is on the lungs. Bronchoscopy, so that's actually taking like a camera in a tube, goes down your throat and looks around for lesions and whatnot in your actual bronchioles. And then you have your endobronchial ultrasound, which is essentially, I think of tiny ultrasound for your bronchioles. It's just another way of trying to do a diagnosis with the least amount of invasion as possible. You also have a mediastinoscopy, which that'll be checking like lymph nodes and whatnot, usually around your lungs, to see if there's any cancerous activity there from either metastases or your lymphatic system responding to cancer. And all this is usually done by the actual diagnosis is done by a pulmonologist or a thoracic oncologist. Pulmonologist obviously dealing with pulmonary system, thoracic oncologist dealing with your thoracic cavity and cancer. So treatment for it, you have surgical resection. That'll be cutting out a wedge, a whole chunk, a whole lobe, or the entire lung itself, depending on how much the cancer spread. Chemotherapy will usually be done with surgical resection. We all know what chemotherapy is, talking about cancer-killing drugs or cancer-specific killing drugs. You have radiofrequency ablation, which that'll basically be high-frequency waves blasting at the tumor. That versus radiation therapy. Radiation therapy is high energy waves being blasted at the tumor cells. Those two can be used in tandem and also paired with chemotherapy for better effects, as they all will kind of target different cancer cells. And then lastly, you have photodynamic therapy that's usually done at a very early stage, since it's not great at killing larger cancer cells. That's basically a special chemical they'll inject into the tumor. There will be a laser that tracks that chemical and then blast that away from wherever it may be. So clinical practice for me will be nursing. I would be caring for the patient, just like pretty much doing my job as a nurse regularly would. Except some of the special things you're going to take after is any sort of instructions from, say, a respiratory therapist, where they have the little spirometer, blow into the thing, make the bubble go up. Doing those kinds of things, making sure the patient is keeping up on that, recording that kind of thing. So you're monitoring their progress, and then you're also going to be monitoring the patient, say while they're getting up and moving around and getting back to a state where they're getting closer to getting discharged to the hospital. So that way they're not just going to pass out going from their car to their front door because they're too winded because they only have 1.5 lungs now. Some of the other things that I think are a little less noted about what nurses do for patients is you're there to also, especially in the case of a cancer patient, while yes, their family may be there a good bit to support them, you're probably one of the people that they're going to see a whole lot more as they stay in the hospital longer, say for 7 weeks, 5 days a week, they're going for radiation therapy. They're going to be seeing that nurse a lot. So you play a big role in their mental health and how you interact with the patient and try to be a positive influence for them. And some of the positive influence for them may just be kind of being a friend to them, just helping them through all their procedures and just being there for them, being someone to kind of lean on. Another thing too would be instructing them on just prevention of further lung cancer developing or just preventing spread. So both, this would be what I would instruct a patient on, and also somebody that I don't even know just how to prevent lung cancer. So for starters, stop or do not start smoking. Just don't. It's a hard time if you already have started smoking, but it's not impossible. I think I quit cold turkey about 12 times before I was able to finally quit. Then I vaped for a year, and then I finally quit that after I started having PVCs. So that scared me into quitting, essentially. But quit. It does terrible things to you aside from lung cancer. If you vape, there's other terrible, nasty things that does to you, anywhere from popcorn lung to giving you essentially like pneumonia because of the vapor you're inhaling. None of it's documented that it causes lung cancer yet, but that's because studies aren't finished on it because it hasn't been that popular for that long. It still does all the nasty things that cigarettes do, but it's just not documented yet. So quit smoking, quit vaping. Avoid secondhand smoke where you can. It's just about the same thing as smoking a cigarette if you're in the same room as somebody or in the car or what have you. Of course, a quality diet and exercise practices. That's just good for general living. And then it'll help your body if you are a lung cancer patient. It'll just help you recuperate a little bit better. And then getting screened when possible, or if you're high risk. So say you're 55 years old, you've been smoking a pack a day since you're about 30, you should go get screened for lung cancer. That's pretty high risk for developing it. Really, anybody is high risk for developing it if they are smoking. So get screened when and where you can. And then for actual lung cancer patients, you'll be following the standard cancer treatment follow-up protocol as far as if you were getting chemo or radiation or you had a surgery or whatever, you would still be getting screened for all of this. Thank you guys for sticking around. This went a little bit longer than I hoped. Here's all my references. Feel free to ask me any questions or whatever in the discussion board. Hope you all have a good Thanksgiving break.